Hello everyone, this is Monique. I'm going to talk to you today about the ACLS simulation that I went to on June 26th. It was at the Rochester Regional Education Center for employees. Here you can see my ACLS simulation and my accreditations. I have a BSN and I am in my Roberts Wesleyan College going for my master's degree. There we go. The scenario that I saw was a ACLS simulation with a SimMam. However, I did see BLS performed as well. So what happened is the people who were involved, which was 1 RN, 4 MDs, and 2 PAs, they had to do their training for their ACLS on the computer first prior to coming to this class. So all of their ACLS and BLS training had to be done prior to coming to the class. However, they had to do their BLS skills. They had to practice their BLS skills in front of a instructor prior to going to the mock code and doing their mock code for their ACLS. So they did their CPR. Well, they did chest compressions first. They did 60 rounds of chest compressions. They had a sim man hooked up to a computer that kind of gave them a little instructions on how to do their compressions to make sure they were doing it the right depth, the right timing. And then they did their rescue breathing. And I think they had to do like 12 rescue breaths just to make sure that they were giving them at the right time in between. I think there were like 5 or 6 seconds in between. They had to make sure that they were counting right and the right amount of time to give the breaths. And then they had to put them both together and do their CPR, and they had to do 2 minutes of CPR. So they had to practice that as well. And this was done on a SimMam. It wasn't a high-fidelity SimMam that they were doing that on. However, that was not the high-fidelity part. The actual ACLS is the high-fidelity part. But this is what they had to do prior to the ACLS. They also had to practice putting in a nasopharyngeal airway as well as measuring, and they had to practice doing a oral airway as well as measuring as well. And then they had to do the head chin tilt lift and the jaw thrust, just in case there was a chance of a neck injury, just to ensure that there is a patent airway for these patients, if they ever happen to come across them, of course. Now, like I said, there was 1 RN, there were 4 MDs, there was 2 PAs in this simulation that was there. After they did all of their BLS stuff, they kind of went over the ACLS training. Most of them had already had their ACLS, so the instructor kind of just went over the information again. The causes, what could be caused, the H's and T's that can cause the fast heart rates, the tachycardia or the bradycardia, or what the treatments for the tachycardia, the medications that they use, or the bradycardia, the medications that they use, or the pacing that they would need for it. So they kind of just went over that very, very briefly. It maybe took 5 minutes that they went over that kind of stuff before they ended up going into the mock code part of the simulation. They did end up doing a debriefing after each of the mock codes. They had 7 mock codes. Some of the scenarios were the same because you have 7 different people in this mock code. You can't have 7 different scenarios. But they did end up having, some of the scenarios were the same, but they tried to get different scenarios because they wanted each member that was there to be a team leader, which I actually really enjoyed, because having each member there be a team leader actually shows that they can run the code. Now, we all know that RNs do not run codes. However, we do for the first part before the doctors get there. So we do have to know what to do before the doctors get there. We do know that we have to do CPR. We do know that we have to put the pads or the AED pads on. The SimMans that were there were very high fidelity. You were able to hook them up to the AED monitor. You were able to deliver shocks. They had, it was able to talk to you. They were able to, you could hear breath sounds. The SimMam had pulses in the carotid, the radial, and the femoral arteries. This was a very high fidelity SimMan. It was pretty cool actually to kind of hear all of that kind of stuff. It was pretty interesting. The debriefing happened, like I said, after each mock code. Each team leader kind of went over what went good, what went bad. They were able to say what they would have changed, what they wouldn't have changed. It was a very good learning experience. After each of the codes, each team leader kind of was like very scared to start, but once they got started, they were all okay. The observations for the effectiveness of each skill, like I said, their BLS skills. Everyone has to do their BLS skills, which I think is very effective. However, if I had known that they had to do that, I probably wouldn't have shown up right away. That kind of took maybe an hour and a half to get through everybody. Their BLS skills and their airways took, like I said, about an hour and a half to get through everybody, and that kind of took up a lot of time. If I had known that they had to do that, I probably wouldn't have shown up right away. But it's okay. It was kind of nice to see everybody doing their CPR skills, which is not always seen. Like I said, RNs and providers don't usually do CPR, so it was kind of nice to make sure that everybody kind of still knows how to do CPR. The effectiveness of the mock codes is very, very good. I think it allows for a open or closed loop communication. It allows for everyone to practice what can happen in a code situation. It allows for everyone to kind of just focus on the patient instead of what's really going on. It allows for everyone to kind of think out loud of what can be happening to that patient, why they're not responding to what medication they're giving them, or what happened in order to bring them down to the fact that we've had to code them. The team leaders, the effectiveness of the team leaders was actually very strong. They were all very smart, and in the fact that they were able to get through the assessments of the patients. They were able to assign the roles to each and every person when they came in after they got the scenario. They were able to have that closed loop communication, and they were able to figure out basically what happened with that patient within, a few minutes of going through the medications and then going through those H's and T's and figuring out exactly what was causing the reason that this patient may have coded. The instructor was actually very knowledgeable. She had said that she was a nurse for like 38 years or something to that effect. She seemed to know a lot and was able to give her input on a lot of information, and I really enjoyed her learning and her teaching experience. I think her effectiveness was actually helpful to a lot of the people that were involved in this mock code. The benefits, hang on, I'm going to move this down. Maybe I'm not. I'm going to do it this way. There we go. The benefits of simulations. I think simulations obviously benefit a lot from, or people benefit a lot from simulations. I think the fact that you are able to practice real life situations, you can get your skills prepared. The it allows for self-confidence. You can get your closed loop communication happening. It allows for the team leader to set roles. As long as you practice those mock codes, that you can get all of that situation all taken care of to where that those codes can run as smoothly and as efficiently as possible. Now, there are some codes that don't run that way, and it just happens that way. Just sometimes the patient just doesn't respond. Sometimes there's things that are well beyond your control. But for the most part, the simulations can actually help with slowing the pace of the code to where you are able to have total control of the code, and I think simulations help that a lot. So that is it. Thank you very much.